Hi, I'm Jenna Wright, Vice President of the Anchorage Economic Development Corporation. This video is part of a series that breaks down AEDC's 2023 Economic Forecast Report. Thank you to Northern Bank for sponsoring this video series. In this episode, we'll talk about healthcare. Before 2020, healthcare was a growth sector for the Anchorage economy and employment. COVID-19 was tremendously disruptive to the industry. Retirement and other workforce exits by physicians, nurses, surgical technicians, physician's assistants, and medical specialists during the COVID-19 pandemic left large gaps at hospitals and outpatient facilities. Healthcare employment in Anchorage decreased by 200 jobs between 2021 and 2022. All subsectors of the healthcare economy experienced similar decreases in overall employment. The decrease was partially driven by a lack of available workforce in highly skilled medical positions. Hospitals and clinics are struggling to find local talent and to recruit from outside Alaska. In 2023, AEDC expects the need for medical professionals to continue and demand to continue to outpace supply. The ability of the healthcare sector to resume employment growth beyond 2023 will depend to some extent on the following drivers of Anchorage's healthcare labor force. Locally, access to medical professionals is dependent on a stable pipeline of graduates from medical programs at the University of Alaska Anchorage and other institutions, which has been stagnant or decreasing for several years. Long waitlist times to begin education, faculty retirement, and the lack of qualified medical educators have all impacted the number of program graduates. The proposed state budget will increase funding for the WWAMI program, which could double the number of physicians returning to Alaska each year. Still, increases in the number of graduates will lag new funding. In the interim, low enrollment rates in health education programs in Alaska will continue to constrain hiring in Anchorage's healthcare sector. Nationally, hospital systems struggled with steep revenue declines in 2022. Revenue reductions are expected to impact local, private hospitals, which are part of these national systems in the near term. Anchorage's healthcare sector requires a wide variety of workers, from medical professionals to support staff such as custodians, food service professionals, accountants, and many others. Lack of available workforce across all of these occupations has constrained employment in the sector in 2022.